We have Dr. Stephen Liben. He's a pediatric palliative care physician. He's wonderful. He's here with his dog, but he's not bringing the dog up. And he's going to be speaking about mindfulness for healthcare professionals and being with suffering. I'm just reading the title. And he's going to come in a minute.
Okay.
They won't see you on Zoom if you walk around.
But that's okay. Can I use the mic here?
Oh, yes.
Here. I'm going to walk around a bit.
Okay.
Hi, everybody. So, camera guy, I don't know, do your best. I know everyone on Zoom won't be able to see all the time, so I'm going to walk around a bit, up and down. Hi, everybody. Good afternoon. Listen, you're the troopers. It's like 3:45 on a Friday. There's no windows in this place. You've been here all day. You're hardcore. You're the ones that are like serious about your palliative medicine, right? Just to give me an idea of who's here today, like who works in the community? Who works mostly in the hospitals? Okay, nurses, physicians. Okay, and who isn't a nurse or physician? Is it like music therapy, psychologists? Are there other social workers? What, social worker? Social worker, great. Social worker also, great. Pharmacist, cool. Where do you work? At the Jewish, amazing. Okay, great. Yes. I know. Okay. So what I'm going to do, what I'd like is, Betsy, if you could help with this, they have active chat functions, right? So everyone who's online now, who's still awake, and who isn't looking at surfing through your emails and doing some shopping for the weekend and all the rest of it, and you know who you are, everyone, basically, put in the chat right now what your specialty is. Are you nursing? Are you physician? Social worker? Whatever. Can you put it in? Just stream. You don't have to just put the one word in at a time. And Betsy, if you could just read out some of them, that'd be really great. So I can advance. Her mic isn't on. No. Well, I can see now too. Right. Can I click this thing?
MD, nurse, nurses. There's a lot of nurses.
Lots of nurses online at home today.
And they type fast.
I can use this?
Oh, we have an OT at CLSC René Cassin.
I'm clicking it.
Volunteer. A parent and a volunteer.
A parent and a volunteer?
Yes, together. Chaplain and provisional supervisor training chaplains. More nurses, volunteers.
Cool. Thank you so much.
Oh, and a nurse with the Cree Health Board. I don't want to stop.
Oh, excellent. Okay, where's that? Where are you? That person who's working with the Cree Health Board, are you in Montreal? Just right where the city where you're from?
Waskaganish.
Waskaganish. Okay, yeah, no, Waskaganish. No, I know it. Okay, great. I unfortunately don't have any financial, I wish I did. One day, God willing, I'll have some financial benefit from any of this stuff. Right. So the point of this isn't to give you some trick and all that. It's to just present you one particular way of doing things that you might find helpful and might want to look more into. I'll get into what I mean in a minute. This is like the prompt, like the expectations is like lower them. Whatever your expectations are, make them lower. If you just learn about this thing a little bit, that'd be great. Okay, let's be realistic about what can be done in like 30 minutes, right? Okay, so some things I'm going to assume, so if I'm wrong, and folks online, you tell Betsy, you put in the chat if I'm wrong, but one thing I'm going to say is I'm going to assume that you're not broken, that you don't need a talk on resilience, you don't need to be fixed. No one's broken here. Having said that, there are things that can be helpful, and one day, like 30 years ago, someone presented something, I thought, oh, it sounds kind of weird, I don't know if it's for me. But I explored and I ended up, now that I talk about this and I have a practice myself, right? You never know where it's going to lead. Maybe it won't be for you, but maybe it will be. And if you never hear about it, like you'll never know. So this is your chance to hear about it. You'll like it, you won't like it, but you'll learn about it regardless, right? Okay. I'm going to assume you're already doing plenty, that you're not coming here like, I need things to do. I need to improve my to-do list. I need more things to do, like tomorrow's Saturday. I have nothing to do all day. So I'm going to assume you're plenty busy and you don't need more things to do. So I'm not telling you what you have to do. What I'm telling you is what I have found very helpful, and so have others, and there's an evidence base for it also. And you may want to explore in your own way how it can be helpful to you. It doesn't mean you need to do it or jump in. And in fact, I'll get into it, but I think putting your toe in, if you're interested, there are different ways to get your toe in and sort of just start and just see if it might work for you, okay? And the it work for you? There's many different variations of this. I found my own pathway. I've moved different places over like decades in this within the same realm. What is he talking about? I'll try and explain. Okay. And the final thing is, so this is what med students have pointed out, and they're right, because we teach a course called Mindful Medical Practice to med students. They have to take the course. Imagine they have to take it. How much resistance there must be from some of them, right? Who are like, what is this stuff, right? I don't need this. I'm resilience or whatever. So they point out that the system is terrible, that when they get out in the hospitals, no one lives the curriculum we talk about healing and all that stuff. That doesn't happen in real life. It's like, go see your patient, get out of here, write your note, move. And they're right. There's tons of problems. But if we wait to fix them, you're gonna, like, don't hold your breath, right? So I'm not trying to say that this is to toughen people up for a dysfunctional system. I think it's not, do we fix the system or do we work on ourselves? It's both and. I think we need to work on the system, and also, personally, I don't want to wait for the system to be fixed. It's never going to be completely fixed, right? I want to work on how I can live in this crazy world as best as I can, right, and not count on it being fixed, but also not just toughing myself up to live in it either, right? This also refers to global warming and all kinds of political things that are going on in the world. How do you live in this world that's so difficult at times, right? It's so hard without just giving up and giving in. So I'm not trying to toughen you up. I'm just explaining one thing that people have found helpful, okay? All right, and then the last one is something that nobody wants to hear. Sort of, well, listen, you work in palliative care. Does everyone work in palliative care? More or less. I get, if you're at it doesn't mean you have to because you're at this conference, but you're already selling something that people are not interested in, right? They're not interested in, like, dying, right? People don't want to hear about it. Like, your product is like, people are not keen. It's like, you know, one day at the, I work at the Children's, one day at the Children's, it was like, explain your specialty day. We set up a little booth, right? And they wanted a little booth set up in the old Children's Hospital, and we set up a booth, you know, pediatric palliative care. It was like a repellent. It kept people away. It was like, there was like a 15-meter perimeter of no one coming near. It's like, I know palliative care, what could be worse than pediatric palliative, right? So, but we're selling something that people don't want to hear. And what I know you don't want to hear, but it is the truth, that nothing you're going to hear in a talk or that you're going to read or some epiphany that you have is going to change everything and make everything okay. I know that's what we all want. That's what we're all doing all the time in our own dysfunctional ways. Online shopping to feel a little burst of energy, Netflixing, ice cream, whatever it is your particular passion is, right? But there actually are some behavior changes you have to make, and I'll talk a little bit about that also. Okay, so to start off with, there's a significant evidence base for this stuff. Mindful self-compassion. The words turn all people off. The word mindfulness turns people off. It's been commodified. Self-compassion turns people off. I'll explain what it means. But there's good evidence base for it. And just to say, if you're interested in this kind of stuff, the researcher, the primary researcher, Kristen Neff, so this is the website, you just have to go to selfcompassion.org or Google Mindful Self-Compassion. Kristen, who's an amazing person, whose child has autism, she's written about that. She's done a lot of research, she's compiled it all on this website, and she's made every PDF available. So if you want to read through it all, go ahead, have a great time. It's tons of research. She made them all accessible. I don't know how she managed with copyrights, but she did. It's a very popular website. So, and this is sort of the gateway to all kinds of practices and little things. If you want to get your toe wet, I would start here, okay? I would start looking at kinds of practices you could do on your own at home, or you can join an online course, or you can go in person. And I've done all those things over the years. I've gone in person, I've done all that stuff too. But not all at once, one little step at a time. So that's sort of the thing, and there's a good evidence base for it. There's evidence base on patients looking at stress and coping. I'm not going to get into the studies too much because I know the time, and you know, it obviously could go on. And the studies aren't perfect because, like, you know, right? Studies are never perfect, right? There's always problems, right? So there's all kinds of problems, but there is it's decent. It's a decent evidence base, right? More decent than some of the stuff that we do without even studying it, right? So this was looking at caregivers. And then this was on nurses. So this was just to tell you the key part here is that it was an 8-week program. And most of these programs, to have any kind of behavior change, take about 7 to 8 weeks. It doesn't mean 7 to 8 weeks of full time. No, it means that it's like once a week for 2 or 3 hours, right, with homework, and then another week, stuff like that, right? That's what these courses often involve. To actually change your behavior, have you ever tried to change your behavior? Like eat better, right? right? It doesn't happen just because you're motivated once on one meal, right? You go back, you slide, right? And most of all kinds of abstinency programs and so on require about 2 months to begin to get some behavior change that has some lasting power. Because willpower and motivation doesn't last that long. You know that. How many people join the gym and then don't go and then feel guilty, then quit and so on, right? But once you've been doing it for about 2 months, the chances go way up, okay? So there's all kinds of evidence for that. And if we had a pill that could do this, that could increase your resiliency and compassion and have you, I mean, I'd take it. I'd be on it now, right? Right? We don't have a pill, but we have a program, right? So pills and surgery, everyone's keen on pills and surgery, right? But if the lifestyle change, like, no thanks, right? Having said that, there's no lineup here. Like, it's wide open, right? I went down here, right? I go down here a lot right now, and I made the lifestyle changes I can, right? And maybe you too. Maybe there's a little, maybe you'll walk over there and try something, try a lifestyle change, right? With a small step, right? Not with a massive change. It's good to be motivated, but it wears off, you know? Okay. So what is mindful self-compassion? It's 3 things, and that's basically the bulk of this, is to explain what they are, and then we'll do a practice together, and you'll have a bit of an experience of it, a little bit, right? So mindfulness, common humanity, and self-kindness merged together in a practice. What is mindfulness? There's so many misconceptions, it's crazy. It's not about being calm, it's not about being zen, it's not about zoning out. It's actually about being present for what's actually happening, and actually, that's not always a great thing to do. You don't always want to be so present for what's happening, right? Right? You don't always feel good. You don't always like your thoughts. You don't always like the way you feel. But it's about developing your capacity to be with what's already present anyway. So it's actually developing some resilience and some tolerance. And there's lots of enjoyable moments too, but it's not all enjoyable. It's not about zoning out. It's about zoning in. So we're going to do a very brief practice. So I'm going to on the people online, I recommend that you do this either seated or standing up. And I'm going to ask you, so even if you've done this before, I would say let's just do it again. If you've done it before and you're into it, then you understand that it's not like you do it once. You do this as often. So I'm going to ask for those of you that feel comfortable and everything else, stand up. You don't have to, but I'm asking you to stand up. And give yourself a bit of space, right? You've been sitting a lot of the day, right? And place your feet hip-width apart. The dog is actually an employee. She's a hospice dog. She works at Maison Saint-Raphael with my wife. Biki te reste. And she actually is she didn't go to work today, so I took her here, but she actually she's a working dog. Okay, so feet hip-width apart, okay? Hands at your sides. And just with me, this is not mindfulness per se, but just to get into it a little bit, just take a deep breath in through your mouth, through your nose. Shoulders up to your ears. Roll your shoulders back, holding your breath, and then release. Breath out, exhale, and let your shoulders down. Okay? Then one more, breathing in through your nose, shoulders up, forward. Up, then back. Hold, and then dropping them back down. Excellent. Then one more time at your own rhythm, breathing in through your nose, shoulders forward and up. Rolling them back, and then down. For those of you at home on your laptops and on your screens, you can do this while sitting in a chair, right? Okay, so if you're sitting in a chair, you can just place both your feet on the ground. That's what I would recommend if you're at home with this. For those of us here, I hope both your feet on the ground. I was going to say lift one, then lift the other and see what happens, but that never works well. Okay, so both feet on the ground, hip-width apart. And just taking one, so what you're going to do is you're going to take a step forward when I say to, but I want you to just bring your attention to the sensations of what's going on when you bring your foot forward, like how you're going to be shifting and how it's going to feel slightly more weight on this foot and all the sensations. You're not trying to think your way through it. Thoughts are going to happen. They're always happening. But actually just bring your attention to the physical sensations that are happening as you do it, right? So even before you do it, like even how does your foot actually get forward? Like how that mechanism works? You're not going to figure that out, okay? So when you're ready, just take a step forward and place your foot down in front of you, right? Right? And just notice the shift in energy, okay? And the sensations on the ground, and then bring your foot back, okay? So now we're standing like this. Now just rocking back and forth a little bit and coming to center. So the point of rocking back and forth was to find your center. Then eyes looking out maybe 2 or 3 feet in front of you, softly focused. I wouldn't advise closing them because we're standing up, you'll fall over. And then bringing your attention to your belly, and the best way to do it is to bring your hand to your belly. So just let it rest on your belly, and just bringing your attention to the sensations of your belly rising and falling, because as you breathe in, don't force a breath. When you breathe in, your belly will go out, right? And then as you breathe out, your belly will go back in. And I'll be quiet for like 15 seconds and see how well you can track the sensations of your hand on your belly for like 15 seconds. Great. So you can take your hand off your belly. For those of you online who did something like that while you were sitting, if you could type in the chat what you noticed. 1 word or 2 words, what you noticed. Not a long sentence, just 1 or 2 words, what you noticed. Is anyone here willing to say what they noticed? 1 or 2 words. Sorry? Can't see, right, but you can see Betsy maybe if they did it. Is anyone willing to say just, what did you notice? Was it easy? Was it hard? Were you able to follow your breath? Antsy, yeah. Did anyone else here get antsy a little bit? Like it's taking too long? Yeah, for sure, yeah. Rhythm, okay. Just the rhythm of it. You felt the rhythm of it? Okay. Was it easy to keep your attention on your hand, or did your mind drift? Who's drifted? Right, that's the way our minds are built. They're built to drift. They're not meant to stay on one object all the time at all. And did you ever, when you drifted, did you ever go back and notice that it drifted? Right? So that moment of drifting, when you notice, right, I'm dreaming, I'm thinking about whatever you were thinking about, supper or whatever it was, right? The most common things, right? That moment is a moment of mindfulness. It's remembering that you're supposed to bring your attention on your hand. So actually you go, oh shit, I forgot. But actually, that's the moment of remembering. If you were completely lost, you wouldn't even notice. People that are completely lost in thought aren't even aware. It's like you never walk, you know somebody who's, you must know some people that are like, seem really angry all the time, and they're physically angry all the time. And if you ever say anything to them about it, like, you know, they'll be like, I'm not angry, you're angry. You know, like they're not even aware of what everyone else sees around them all the time, right? So to be lost in thought, you wouldn't even be aware. So this is about waking up from being lost in thought. Most of us are lost in thought like almost all the time. And to be mindful, please sit down if you want to, if you sit down. Most of us actually, during meditation and on, are lost in all kinds of fantasies and thoughts about the past and the future. We either replay the past or we're worrying about the future, right? So, yeah, did anyone else say anything from online?
So someone said that they were calm, mind was easily wandering. Someone closed their eyes and felt really calm, focused. One person said 15 seconds is long.
Yeah, that's great. That's good. And then if we were all sitting down, some of you would have started to fall asleep. Any group of healthcare professionals, if you have them relax a bit and breathe in and breathe out, within 10 seconds you're snoring, right? That goes on. And that just shows the lack, well, there's different reasons for that. We won't get into that, but one of those is just not enough sleep. It's not complicated, right? So that's kind of a mindfulness practice. That's a guided awareness practice that you just did, right? So mindfulness, you don't have to do that for mindful self-compassion, but it's the awareness of what's going on other than just your thoughts, right? It's sort of seeing your thoughts over there. So one way to look at it, so this is a classic kind of thing that happens during when you sit for a few minutes, right? Am I in the moment? I want chips, I'm hungry. How will I know if I'm in the moment? Is this the moment, right? That's normal. That's not abnormal, that's normal. That's what it's like to meditate. People have this vision that meditating is somehow blissful or something. I wish it was. It's actually work. It's actually not always easy to do it all, right? The other thing is sometimes you breathe in, then you think about every mistake you ever made in your life, and you breathe out, okay? So that also happens. That's also the reality of sitting, right? I'm not selling it too great, am I? Like, it's not very appealing, right? But that's sometimes what happens, right? And actually, when you create a bit of space, stuff comes out. You know, when you poke around in the mind, stuff comes out. So it's not always easy, right? But the alternative is, like, you're trying to fall awake is the point of this. Like, oh, this is my life. Like right now, believe it or not, this is your life right now. Right now, what you're thinking, feeling, sensing, this is it. You don't know what the future is going to be like, and you're never in the future anyway. You're always where you are. You're always right now, right? But this is it right now. This is not some preparation for something else. For later, you're thinking, some of you are thinking, I can't wait to get out of here if you just shut up and you can get to supper, right? But then at supper, you'll be at supper and then you'll be enjoying it for a second and you'll be thinking on the next thing. I want to watch Netflix. And then it's always the next thing. It's never just okay enough, right? Even right now, can this be enough right now that you don't need something more? Okay. So the idea of mindfulness is that you don't over-identify with your thoughts, because when you're lost in thought, you're not even sort of aware of them. You're sort of just living them. So I think the picture shows it better. So on the one hand, when you're lost with your problem, your life is your problem. Biki, tu restes. Biki, kush. Somebody was supposed to be here to help me with her. Actually, she's not here. She didn't show up. It's okay. No, don't. Please don't do anything. She's a trained mirror dog, so she just let her. If she's not bothering you, if it's okay, just leave her be. So it's about being so you see your problem as one of the things in your life, as opposed to it being your life. Does that resonate? Do you ever have times where you're just so lost in your problem, you can't even see it as a problem? It's just so like everything, right? When you're really stressed out. Okay. Compassion, you know what that is, right? So it's not just empathy. It's empathy, feeling somebody else what they're feeling. And actually, it doesn't even have to be empathic. We don't have to make the bar so hard. You don't have to know what your patient's feeling. Isn't it enough just to know they're suffering? That they're not doing well? Maybe that's enough. They're suffering. You don't have to know exactly what they're feeling. You don't have to be an empath. You could see someone suffering, coupled to the desire to alleviate it. So it's an action plus a feeling, right? Both. That's what compassion, that's the kind of definition most of us use. And to be compassionate is actually a skill you can learn. And it basically involves learning to tolerate your own uncomfortableness. In palliative care, a lot of what we have to watch out for is treating patients because we're uncomfortable with what's going on. We see family members, right, that complain about the sounds at the end of life, the death rattle, and we know the patient's unconscious and clearly fine, faces relaxed and everything else, right? What are we treating? Who are we treating there? We have to watch for what's easy is we forget to separate our discomfort from the patient's discomfort. So can we tolerate our own discomfort, and how can we improve that? So this is about the compassion that we do every day with patients, right? And turn it around towards ourselves. It would be like a superpower if you could actually self-regulate and self-soothe. Imagine having practices that will allow you to self-regulate and self-soothe and calm yourself down and bring yourself back to the kind of person that you want to be, however you define that, instead of needing something on the outside to do that. Okay. So being kind versus being nice. I'm not gonna get into this because of time. But it speaks to some of the myths about kindness. Anyway, whatever. So the other thing is common humanity versus isolation. So one thing is to be mindful on where I am suffering. That's mindfulness, right? Two is I'm not alone. And that the key is this is not a mistake. I feel crappy. I'm suffering. I'm in emotional pain. This hurts. It's not a mistake. It's part of being a human being. It doesn't mean you don't have to do anything. But the myth that you can get through life without having any moments that are tough for you is just that. It's an unhealthy myth. It's not a problem to be solved all the time. You know, loss is part of life. You lose things all the time, from people that you love, to your youth, to your anything you want to name. We lose things all the time. And we're going to ultimately lose everything. People here know that. You work in palliative care, right? So we're not alone in this. This is the human condition, and everyone goes through this. It's not just you. And that's why this is the opposite of narcissistic mindful self-compassion. Because instead of it being poor me, it's like, yeah, this is what it is to be alive. It sucks sometimes. It's really hard. I'm not alone. This is what everybody goes through. This is what it's like to be alive. Thinking that it's a mistake adds to the suffering. It's what we call second arrow suffering. It's sort of another arrow shot onto the first arrow. First you suffer, then you feel like it shouldn't be, that somehow the world should be better. It shouldn't be this way, right? But that's the way it's always been. There's some suffering with the world. Okay. Okay. So the other thing is compassion. So for those of you at home, if you can get up out of your seat for a moment, this is going to take 1 minute. Everybody get up again. I'm waking everybody up. I'm doing this on purpose, right? You're going to make us stand up. Last time you have to stand up, okay? So, so compassion. When you think about compassion, do you think about it as something soft, hard, weak? What do you think of, Golda, when you think of compassion?
Caring. I think of caring.
Caring. What's an image that comes to mind when you think of compassion? Somebody else? Anybody else? Huh? Love. Okay. Yeah. And a lot of people see it as something like kind of meek too, though. Sometimes, right? It's not. It also is what Chris Germer and Kristen Neff talk about, fierce compassion, right? So if you just take the stance now of the horse riding stance, so feet wide, legs wide apart, like this, like you're ready to ride a horse, right? And you have your hands out like this, put your hands out, right? And then just do with me, go, no. 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 One more time, louder. No. Right. Right. Good, sit down. The ability to say no is also mindfully self-compassion, right? So you're not just saying yes to everybody and falling over and all soft and gooey. Sometimes you have to draw your boundaries and say no. Right? And say no. So compassion has a fierce aspect to it too. No for yourself and no for others, for your patients and all the rest of it. It's not just about everybody should get everything, right? That's not the point. Okay. Fierce compassion. Okay. Where are we time-wise? Okay. Self-kindness versus self-judgment. So the three circles, one of them was mindfulness. The other one was common humanity, right? That we're not alone. And the third one is self-kindness practices. And there's two types. One is the words that you say to yourself. And then the second thing is physical things you can do, self-touch as well. And you take the course, you actually practice finding the phrases that work for you, because phrases that work for one person sound corny to somebody else. Phrases that work for you are very personal, and you'd find your own phrase. Like I found my own phrases, right? And the self-touch stuff also. I'll explain what I mean in a minute. But this is all opposite what usually happens. So I don't know about you personally, but I do know about our society. So when I'm walking, and tripping isn't a great example. When I make a mistake, when I say something wrong to a patient, I wish I didn't afterwards, or to a colleague, or to my wife, or to anybody, or to the dog, right? Right? What's the reaction? Is it, oh, Stephen, you made a mistake? No, the reaction for me is much worse. The way I talk to myself is awful. And you have to wake up to what that is, the way you talk to yourself. You have to actually listen to that, because you may not be aware of how you talk to yourself. If you become aware of it, it's actually shocking. Most of us, in this culture in particular, not necessarily Oriental cultures that were brought up much more communally, but we're often very harsh, like you effing idiot, stupid, things that we would never say to somebody that we love. We often say to ourselves. Does that resonate at all, or is it just me in this room? Does anybody else have an inner self-critic that's pretty rough, right? So why do we talk to ourselves in ways we would never talk to somebody that we care about, right? There's all kinds of false beliefs built into that somehow if we don't whip ourselves, we'll just become complacent, right? That's one, for example. That if I become mindfully self-compassionate, people say, if I do that, then I won't get my work done. I gotta whip myself. It's all reward. I gotta do that, right? Well, okay. If any of you have kids, or if any of you have been a kid, that's a bad joke, the dad joke. Right? Do you want your child, or would you want, if you were a small kid who made a mistake on the math test, do you want the teacher saying the kinds of things you say to yourself, like, you're stupid, you better work harder, you're dumb? Do you want that? Or do you want the teacher saying things like, oh, you made a mistake, you got it wrong. I wonder where you went wrong. Let's work on it together and see how we can do better next time. Would you like to work with me on that? Don't you want the teacher saying that to your kids? Some version of that, right? And yet that's not how we talk to ourselves. We're worried if we don't slam ourselves, right? It's not true. That's why they've done the research, that being more mindfully self-compassionate leaves you complacent, right? It's not, because self-kindness isn't self-complacency and isn't it isn't first order questions. So when you say, you know, how do I be kind to myself? The first answer, what do I need, might be, you know, Netflix, ice cream, alcohol, whatever your particular demon is, whatever, shopping or whatever it is, right? But the second order question is not just what I want, what do I need, what do I really need, right? When you have enough time and patience and energy to hold the negative feelings enough to ask yourself that question, the answers can be really interesting, and you know the right answers yourself. What do I really need? You know, do I need a second pint of ice cream tonight? You know, maybe, and then the answers open up for you, right, about what you really need, right? You know, so and these are answers only you answer yourself. So self-kindness isn't about self-indulgence at all. And just eating lots of ice cream. There's room for that. There's room for eating ice cream and Netflix, absolutely, and I do it, 100%. But there's also the higher level stuff of what you know you really need to make changes, maybe in your life. Okay. So it's the kind of phrases that people use, and we're going to do a 3-minute practice in a minute together, and you're going to find some of the phrases won't work for you. You're like, it's corny, because like I said, we're doing it rapidly. You haven't picked your own phrases. But anyway, may I be kind to myself? You know, it's okay, it's okay. What do I need? What do I really need? And then the self-touch stuff, there's actually some stuff with vagal nerve. There's the whole vagal nerve stuff about activating the vagal nerve and the parasympathetic nervous system and toning down the sympathetic flight or flight response with some physical things you can do, like taking circular breathing, right? Like the kind of thing where you take a 1, 2, 3, 4 breath. 1, 2, 3, 4. Hold. 2, 3, 4. Breathe out. 1, 2, 3, 4. Like it actually, that's called box breathing. You can look it up on the web, right? There's things that actually do calm down the heart rate and everything. Like there are some physiologic stuff correlates to this. Nothing's perfect, but it does help, right? If you're all charged up. So there's some self-touch stuff. And like for me, you know, who worked in the workshop, it was when I put my hand on my chest, and even now, just probably putting your hand on your chest, one hand, your right hand on your chest, your left hand, and your other hand on your belly, and just apply a bit of pressure, just see how it feels. Like it may not work for you, for example, right? Some people prefer they actually rub down their arms. And so you'd have to play with what works for you for self-touch. But if you ever, now you know, if you ever see me walking around like this, you know, he's not doing so well. He's trying to calm himself down, right? These are stealth practices, right? So these are things that no one would know that you're doing, right? For some people, it's rubbing a certain way. So it's self-kindness, that third circle. It's the words that you say to yourself in those moments, and the physical things you can do also. That there's something you can actually do to calm yourself down and bring some self-soothing to yourself without needing drugs, alcohol, somebody else to give you compliments, whatever the particular thing is, right? Okay. So we're going to do a self-compassion break. Now I'm going to talk you through it. It's going to take 3 minutes. It's an imaginative exercise. Some of you are going to go, yeah, I don't like this, it's not for me. Some of you are going to go, well, I don't know about this, I'll explore further. And that's the point of this. I know this is not for everybody, and also may not be for you now. I must say, I learned about this stuff. I wish I learned about it earlier, I got to say, but you never know when someone's open to this. So, sitting comfortably, maybe place both feet on the ground, okay? Placing your hands, it's good if they're on your thighs, in your lap. I'll sit down for this. I don't know if the camera can follow me for people online, because it's good if they can do it from their laptop. Can you see me? Can the camera see me? Yeah, oh, perfect. Okay, good. So hands on your lap. And sitting straight. So you actually take your time. You know, when you're really rushed, did you ever notice you're kind of sitting on the edge of your seat, you're on your laptop, banging out that note over lunchtime and you're eating like this? If you look what's going on, it's like, just take the time, sit properly like this, okay? And your seat, rock back and forth, find the center line. You can do this privately. If you have an office, you have a workspace, you can do this too. What's wrong with doing that? Why not, right? Sit properly, but be grounded. Hands on your thighs. And then take a purposeful deep breath again. So we'll do that. Let's do some box breathing for 1 cycle, okay? So when you're ready and if you feel comfortable, only do this if you want to and you feel comfortable. Breathing in through your nose. 2, 3, 4. Holding. 2, 3, 4. Breathing out. 2, 3, 4. Slowly, holding. 2, 3, 4. And then one more, breathing in. 2, 3, 4. Hold. 2, 3, 4. Exhale on 4. 1, 2, 3, 4. And then resuming your normal breathing, okay? So I'd ask you to think of a situation in your life that's causing you stress right now, right? And the point is not to pick a 10 out of 10. Okay, so if you have a 10 out of 10, put that over there on the side for now. The 10 over 10 goes over there. Something that's like a 6 out of 10, a 5 out of 10. So what kind of things am I talking about? It could be a health problem that isn't a 10 out of 10, a relationship problem, a work problem, or some other struggle. Can you bring it to mind? Can you find something? Maybe you don't want to, right? You're going to bring some self-kindness to it if you can do that. So you're choosing a problem in the mild to moderate range. Visualize the situation in your mind's eye. What's the setting? Who's saying what to whom? What might happen, which is where a lot of anxiety comes from, right? Can you feel the discomfort in your body as you bring it to mind? Can you even label what the sensation is like? Perhaps a contraction in your chest, a slight tightness, right? Maybe it's your neck, right? You can feel a little bit of the sensations that come off at the same time. Now try saying to yourself, this is a moment of suffering. That's mindfulness. That's being aware that you're suffering. Perhaps other wording works better for you, like this hurts, or ouch, or this is stressful. And now try saying to yourself, suffering is a part of life. That's the common humanity part. Other options include I'm not alone. Everyone experiences this just like me. And this is how it feels when people struggle. Like everyone goes through stuff like this that I'm going through right now with this particular problem. And now offer yourself some kind of soothing touch that you think might work, be it rubbing your belly or rubbing your thing or just placing your hand here or placing your hands with a bit more pressure on your lower legs. And try saying to yourself some self-kindness phrases, whatever might work for you. And I know you haven't experimented with them. I'm just going to throw some out there. May I be kind to myself? May I give myself what I need? Like, why not? What I would offer, the kinds of words you'd want to hear whispered into your ear for the rest of your life. It's okay. It's okay for me. It's okay, buddy. It's okay, Stephen. These are the words I tell myself when I'm really stressed out. All right. Okay, Stephen. Okay. I talk to myself like I'm a dog. It works for me. It won't work for you. It'd be corny, right? But for you, find your own words, right? Okay. Okay, buddy. All right. Okay. Right? May I forgive myself. May I be strong. May I be patient. Right? And if you're having difficulty finding the right words, think of somebody that you love who told you that they were struggling with whatever problem they were having. What kind of words would you want to say to them to be supportive? I'm not talking about fixing their problem. These are unfixable problems, right? This is life situations, right? So what kind of words would you say to your child, right? What do you say when they're really suffering and you can't solve it? It's okay. I'm here. I love you. It's okay, sweetheart. Whatever those words are, offer them to yourself. Why not? Aren't you as deserving of the kind of love you offer all your patients and your own kids and family? Are you any better than them or worse than them? You're just another human being. You deserve it too. So you offer those words to yourself as well. That's it. That's it. So that's an example of a practice. And on that website, that Krista, they verbally go through these. You can actually have them guided. They'll guide you through them. There's different ones. This is called the Mindful Self-Compassion Break. It's 3 minutes long. And I'm not suggesting you just go on and do that and that takes care of everything. Absolutely not. But it's one of the practices that people have found helpful, and there's a whole slew of them. There's all different kinds of ones also, and different ways of practicing. Hey, so we did all that. I'm just looking at the time. How much time do I have left? I'm done? Probably, right? Okay, another minute or two. There won't be lots of we're kind of trying to do this a bit interactive anyway, right? I mean, I had my own, this was like about 2 years ago now, I had suffered through 3 massive losses myself in my own life. My sister died suddenly. My kid sister, 9 years younger than me, just went to sleep. Social worker, went to sleep. And her husband called me and said, Tracy's dead. I'm like, what? She was like, fine, right? She just died in her sleep, right? A good colleague of mine, Ron Gottesman, some of you may know from the ICU, was flying to meet his wife in Florida, same year. This is a few months later, and went to the airport, called her from the plane, said, yeah, I'm getting off the plane, I'm feeling a little achy, I'm not sure, maybe I'm coming down with something. Went to sit down for his luggage, and he never got up. They found him dead, sitting there, waiting for his luggage, okay? And then a third one was my colleague, who's 2 years younger than me, who went to the gym. He was about to sign over on a Monday morning. I had just walking back in the woods at the cottage. I didn't have the dog yet, but anyway. And his wife called, who I'd never spoken to before, and said, Louis died. I'm like, what? He's like signing over in 15 minutes. He had bent down to start an exercise, and he just keeled over and died. There were 3 sudden deaths like that, rocked my world. And this is like the same year. So that's Westmount Park. That's a picture I actually took when this happened. Not that all this didn't happen at once. I was just walking. I was just completely like, I don't know. I was like, this is a few months after all these things had happened, right? The funerals and all that. And I'm walking in Westmount Park, and I'm walking back, and it hits me. I'm like, oh, Mr. Mindful Self-Compassion, Mr. Meditation teacher guy, this is it. You're suffering, right? I mean, I knew I was suffering, but like the awareness of it, instead of just being suffering, I'm like, yeah, this is suffering. This sucks. And I'm not alone. People go through this and go through much worse than this. Not putting down what I went through, but not making it the biggest problem. Like, it's my problem and it's a big deal. It's my kid's sister and all the rest of it, right? But like, this is a moment of suffering. That, just naming it. There's power in naming, right? We do it in clinical practice. We name things for patients. This is a moment of suffering, and a bit of, well, the walking, I did a walking meditation, and I asked myself the questions, which I didn't answer right away. What do I really need? Like, what do I need? But then what do I really need, right? And I came to my own answers in that. I made a few life changes. One big one, I took some time off work for the first time in like 30 years, right? I just realized I can't go to work, right? I'm not suggesting that that's your answer, but you come, and so I found it really helpful, and I was completely lost in thought. And it came down to that for me, right? So this is the things you don't want to hear. For any of you who like Spider-Man, right? This is her talking to her boyfriend Spider-Man, right? Tell me the truth. I'm ready to hear it. Tell me. Self-awareness isn't enough. You also have to put in the work to change. She's like, oh, right. So if you're interested, there's paths you can take. Is meditation the answer? What do you think? Jeff, is meditation the answer? What do you think? Not for everyone. Okay. I don't think it's the answer. I don't think there is an answer. I think it's a false question in a way. I think there is no answer. It's not a question. Life is not a question. It's like a mystery that we live. It's not a question with answers. There are questions and answers in life. And for me, a meditation practice over time has changed the questions. It's changed the nature of the questions. It hasn't really provided a lot of answers. Some of the questions kind of fade away. Like, what's the meaning of life, for example, right? It's a question that's just sort of faded away. It's kind of not really relevant anyway. So, but there are things you can do. And so I'm going to end with this. What's one step that you could take in your own life, a positive direction to bring a bit more joy in your life? What's something that you could do? And maybe it's doing something new, yoga, exercise, meditation, nutritional counseling, something, right? Maybe that's too overwhelming. Maybe you don't need to do anything new. Maybe you need to stop doing something, right? So what is it that you're doing that you shouldn't be doing, that you're draining you? You're doing it for other reasons, but it's not really helping you. What's something you might want to stop doing? Just to think about it. I refer you to the website, and if any of you want to talk to me about it, it's my pleasure anytime. That's my personal email. I thank you so much for your attention. I hope you have a great weekend and a great afternoon. That's it. Thank you.
You can stay if you'd like.
No.
Thank you, Stephen. I can't think of a better way actually to have ended what was, for me, and I think many of you would agree, I hope all of you would agree, a really wonderful day of learning and connection and inspiration and reflection. Thank you so much to all of you for being here. Thank you to our presenters. Thank you to Dr. Chudinski and the rest of the Scientific Planning Committee. Thank you to everyone for filling in your evaluation forms. And I'm going to invite Dr. Chudinski up to just say some final words.
Yeah, thank you, Stephen. I didn't realize that you could be so funny at the end of the day. It's great, but also thought-provoking. In fact, it's been, from my point of view, a fantastic day. I want to thank so much all of our speakers. I think everybody brings something different, but it's somehow all tied in together, I kind of think. There's always people who are behind the scenes who I think we kind of tend to forget, and I wanted to absolutely thank Devin Phillips, who's been always there for every one of these CPD days, but she's also gotten some new help. So Dalia Campoli, I want to thank as well. And Karen French, without whom I don't know where my head would be the majority of the time. So I definitely want to thank them. Bessie, you're great. Thank you so much for being our MC year after year. And again, thank you all for your participation. We wouldn't have these great CPD days without you being there, but also giving us feedback and giving us ideas about going forwards, what you would like to learn about, what you'd like to hear. So please do fill in all these evaluations, but also tell us what you want to hear about for the next times. So I am going to keep it brief. Wish you all a fantastic weekend. There will be videos, and the presentations will all be available, and so you can get a chance to maybe go over some of them in the future, but maybe not this weekend. Give yourself a chance, a little self-compassion, a little mindfulness, walk in the park, and till next time. Thank you.